Hello, I'm Dr. Phil Huang. I'm the Director of Dallas County Health and Human Services. And we're here, and I'll let Kayla introduce herself in just a second, but we're just pleased to be able to present to you this digital presentation for HO 360. It's our DALISS, or Disease Analytics and Localized Investigation and Surveillance System, and its impacts on public health. So turn it over to Kayla to introduce herself.
Thanks, Dr. Wong. As Dr. Wong mentioned, my name is Kayla Sims. I'm a consultant at Accenture and I work alongside the Dallas County team on this system. I'm excited to be presenting with Dr. Wong today.
Great, thanks. Well, we're going to start out with some slides. See them? Yeah. So again, as I mentioned, this is our DALISS system, Disease Analytics and Localized Investigation and Surveillance System. And this is us again. But just as a little background, Dallas County Health and Human Services, our mission, optimizing and protecting the health and well-being of all Dallas County residents, and supporting achievement of better health outcomes for all. We are a full service public health department. You can see all the different programs. One thing that we point out, we actually serve a population of over 2.6 million residents. We have 31 municipalities within Dallas County, of which City of Dallas is just one of those. And our 2.6 million is over a larger population than 15 states. So even though we're one local municipality, county government, actually by population, we're bigger than 15 states. I think a lot of our data modernization, like for many people, started out with COVID and just saw the stresses that were put on our systems, the volume of cases and electronic or lab reports and things that were coming in. And, literally at the beginning, we had stacks and stacks of paper faxes and medical students manually entering that data into a system that was quickly overwhelmed, and we couldn't even keep up with it. And I've tried to mention that it was literally trillions of dollars worth of policy decisions being made based on our public health data. You recall everyone every day was looking, are the COVID numbers going up? Are they going down? Do we need to close bars? Do we need to close schools? Do we need to require masking? And it was all based on our public health data. So we started modernizing our system, working with Accenture on the development. And one of the things I want to mention from the start, maybe throughout, we're going to be presenting what we've done with our system, but we really are at the point that we want to see how can we share what we've done, how can we make this available to other health departments, small or large. We're very open to, we should now have to be reinventing the wheel on this. So, we are very open to how can we try to make this share what we've done or work with others. Just a high level overview of the solution. We've got a lot of the data that's coming in, and we've been processing it through Rhapsody and MuleSoft, but we have now electronic lab reports. We have the electronic case reports that are coming in from hospital EHR systems. We have our state immunization registry data for our county. We have our mortality data. We have the post-NEDS labs, the labs from the state system that have been processed by the state system. We have all the closed NEDS investigations. After we do our investigations, we bring that data in. We brought our homeless management information system data into this. We are looking at we're finishing up some of the STIs, HIV, TB, and we can bring in some other social service, environmental health, and other data. The processing, we bring it into an Informatica master data management system to do our matching and merging, address validation, data transformations, updates, deduplications, and we'll show you some of the things that we do with that. And then we're using Salesforce for our surveillance to do disease monitoring. When we need to do investigation, we do those investigations in Salesforce, input the data, we do contact tracing. We can stand up hundreds of contact tracers now in an instant, setting that up. And then we have outbound integration back to the state NED system or other state or federal systems. For analysis, we use Salesforce. We can do a lot of standard reports. We'll show you some of that. Customized queries. We have Power BI data visualizations. We have dashboards. And you can also just download the raw data. And the other thing about Salesforce, we're using some of the communication tools. We have Salesforce Marketing Cloud, so we can do text messaging, emailing, phone, and get monitoring of those sort of things. So that's sort of the pieces that are part of the solution. Here's a graphic display of that with all of these data sources coming in on the left side, being processed by either Rhapsody or MuleSoft, coming into this master data management system, being address validations, deduplication, inbound staging, outbound staging. We also then put the data into a separate data warehouse, and we can put Power BI dashboards on. Anything that requires investigation or we bring into Salesforce. And again, we can use Twilio, emails, and then we also, Parkland Center for Clinical Innovation is one of our tools that we do for the address validation, and then bring it all back in and report it back into the state system. And currently, that's actually our biggest bottleneck, is getting that back to the state in an automated. Some of the future state that we're looking at with this, we now have a FHIR and connection to TEFCA. We're using eHealth Exchange as our QHIN, and we've been piloting a connection with our large public hospital system, Parkland Health. And so looking at, we've already made the connection, doing some testing and piloting that into our broader connection to the TEFCA system. We're also exploring trying to do bulk FHIR transfer for chronic disease data, again, using eHealth Exchange and the FHIR push coming from Parkland to get chronic disease data. That's in the future. Just wanted to show some of the sort of things that we do with our master data management system, and these are some of the dashboards that we get from our Informatica MDM. But you can see summarizes, we have 4.9 million master records in our system. That's based on 7.2 million source records, 2.5 million duplicate pairs. Some of the records haven't been matched. Then these are record pairs that are pending manual review by our data stewards. Again, we can get this dashboard visualization of what's going on with our system. Here's sort of a match analysis that looks at, here's all the data sources and the number of records that we've had from each of those data sources. And then you can see how many matches from, for instance, MTrack to Salesforce. And the intensity of that shows how many matches there have been. Again, MTrack and Salesforce are our biggest contributors, so that doesn't, it's not surprising that they have the most number of matches. Some of the match models, we have different match rules, and you can see a report on based on rule number 8, which has a fuzzy match, person name, and some other criteria, and it gives a match sort of score, how likelihood it's a match. We actually automate after looking at these, and anything that has a score of 85 to 100. And you can see we've had 42,000 record pairs that have been automated in that match. Some of them in the exact match with rule number 3, we've got 13,000 record pairs. So again, you get this report on what's going on with our matches. And then this is, it shows some of the runs every day. These matching, merging is going on every day. June 11th was the one. It lasted 42 minutes. Success, 6,869,000 records were processed. 1,242 record pairs were matched. So this is, again, the visibility we have on this process. And this is for our data stewards, the sort of workflow that they get when it is questionable, when it doesn't meet that score that shows that, yes, this is an automated match. Then our data stewards get these. You can see here's what the master record shows. It's an example of Jim versus James Phelps. And then they look at the whole record, look at all the different fields and determine if it's should be a match, and then manually do that and approve it or reject it or release it. So that's some of the master data management. And now what we're going to do, and Kayla is going to go into a demo actually of our system using Salesforce. So let me turn it over to Kayla.
Great. Thanks, Dr. Wong. Okay, so as we enter into the Salesforce system, I'm starting us out here on the homepage. And just a note for this demo, I am showing everything from a system admin profile. So you're going to see what it looks like from the most privileged point of view. But we have it broken down into profiles and permission sets so that users are only seeing the information they need to see. So if they're working on communicable diseases, they have one profile. If they're working on STIs or HIVs, they have a different profile where they'll see more granular information on this homepage. But first thing I wanted to call out here, so this is where an investigator would go to pick up an open investigation, so one that's not assigned to an epi already. Up here on the top, you're seeing that for the communicable diseases. Then we have it for the STIs. And then lastly, the care navigations, which we'll get into a little bit later. Another thing I wanted to call out on this homepage is this appointment and task calendar we have over here. This is something we built out for the Ending the HIV Epidemic team at Dallas County, which is a specialized team that works with linking HIV patients to care. And you see on this calendar, we have some color coding going on. So if you see a green item here, that means that user has a task due that day, and they can actually click on the calendar itself. So I'm going to click on this one on the 16th, and it takes them directly to that task and lets them know what needs to be done for it. Mine's taking a second to load here. But I'll go ahead and go back. You see that it takes you into the task. The black days, that means they have multiple items due on that same day. So I can click here and it shows me the multiple items. I can note if I want to go to that first task that's due or the second task that's due. And it takes me there and it lets me know what needs to be done for that task. These blue ones note that I have an appointment that investigator is assigned to. And click in, can go to the appointment. And then the purple and orange are also appointments as well, but the purple lets them, so the blue means that there's no denotation on if that patient needs transportation. The purple notes that even though that investigator is assigned to that appointment, the patient doesn't need help getting transportation. And then the orange appointments note that that investigator is in charge with helping that patient get to and from the appointment, or they need to attend the appointment with them. But like I stated before, this is where they can open up or pick up an open investigation. So I'm going to go ahead and click on this patient and their open HIV investigation, and we'll walk through that.
And
So
one
since
thing
I
we should
click-
mention, this is actually UAT, right? So
Yes.
it's all not real data.
Correct. Yes, this is all fake data, so you're not seeing any PII here. But since I clicked on that person's name instead of the actual investigation number, it takes us directly to what we call the person account. And this is where you're going to see details for the patient, such as their name, gender, gender identity, sexual orientation, their phone number information, also their current address notification, country of birth, and any emergency contact information on this details panel. And then if we pop over to the related tab, that's where you're going to get a view of all of the records that are related back to this person. So I opened up a newer person account for this purpose of this demo, so you're not going to see a lot linked back here, but I'll walk through what could be linked back. So this reportable condition history is going to be those communicable diseases for this person. STI is going to show any STIs linked back to them. Same thing for TB and COVID. Test results is going to show any relevant test results for any type of disease. Same thing with vaccinations. And then with these person addresses, this actually shows every relevant address we have for the person. And it denotes their start date and end date. So when that person moved into the address and when they moved out. And then these homeless project records is something we have with the homeless integration we saw earlier on the diagram. This notes any project the person may be enrolled in or social services they're enrolled in that may, if they're an unhoused person, so we can track that here as well. But I'm going to go ahead and scroll up and click into this HIV condition history for this person. Just a quick overview of the condition history. This is where the long-term information is going to live for the person. So information that's not going to change each time that an epidemiologist reaches out to the person. So the date they're diagnosed with HIV, the date they're diagnosed with AIDS, the facility they were diagnosed at, and if they're eligible by the CDC standards for as being denoted as having HIV or AIDS. Then same thing down here with the treatment. But I'm going to pop over into the investigation next. And this is where you're going to get the information that possibly might change on a daily basis, or not a day-to-day, sorry. Each time the epi reaches out. And what I'm going to show here is actually an automation we have set up to note if this patient needs any type of follow-up, and specifically, I'm going to go through what it looks like if a DIS investigator goes through this process and notes that this patient needs help getting linked to HIV care. So they're going to need help from that EHE or ending the HIV epidemic team I talked about earlier. So I'm going to go ahead and note on this field right here called type of follow-up and click edit. And I'm going to click that they need to be linked to care. And I'm just going to go ahead and save. It's taking a second to load. But when that happens, if you noticed up here, I got a notification because my user is part of the EHE supervisors group. So I got a notification, and I'll open, if it'll let me open it up. There we go. Noting that this investigation needs a linkage assignment, and it gives me that investigation number and lets me know that I need to assign it to a care navigator. And when I click on that, it takes me back to the investigation we were on. It didn't do much there because I was already on the investigation. So an EHEV supervisor can see that, go to this investigation, and to open up their care navigation, which is their record they use, they'll click back onto the condition history that we saw previously. Scroll down here and to the care navigation records and hit new. And this is where they'll track all of the information they need for linking the patient to HIV care. I'm going to go and get it saved so we can see that page layout. So see, opening it up, I don't have it assigned to a care navigator yet, but it's linked back to that condition history we were just on, and it automatically opens up with a status of pending. So I'm going to go ahead for the next part, assign myself as the care navigator. The next part, I'm going to show some of the task automations we have set up for this team. So say they get into this, they start talking with the person, and they're trying to talk to the person, they haven't gone in contact with them yet. They can denote this person as outreach in progress. And when I do that, on the side, it automatically opens up a task for them labeled establishing contact. And that task is due at a later date. And they'll get notifications and be able to see that on that calendar we saw earlier. And so it relates back to this. They can click to automatically call that person from this record. They can make this a recurring series of tasks because say they need to follow up with this person more often at a set date. They can do that here. And they can also note how they're talking with the patients, whether they're calling them, texting them, visiting them in the field, etc. And then another automation, so say they have linked this patient to care. They're no longer trying to establish contact with them. If I go down here, mark them linked to care, hit save. I'm gonna go ahead and hit reload really quick. Sometimes it takes a second. Okay, we can come back to this later. I'm going to show other items on this. So while they're linking them to care, they may need to set up an appointment for the person. So if we go over to this related tab, we see the appointment object, and they can go ahead and create a new appointment for them. So if they just know they need an appointment and don't have any other information, they haven't actually set up this appointment, they can leave this blank to begin with, just relating it back to that care navigation. But if you have the date and time, they can put that here. So say they set up an appointment for this person on the 26th of June at 2:30 p.m. They can do that here and note whether an AHE staff person needs to help the client get transportation there, or if they don't need to attend, or they do need to attend this appointment with them. They can also note what the appointment type is for here. And again, all of these will show on that calendar we saw previously. Hopping back over, I'm actually going to go back to that case to show you the other records we have for the ending the HIV epidemic team. So the other records they'll use is social services. So this is if a patient needs help getting connected to a social service. So this is where they'll track that here. So they can relate it back to a care navigation if they also are needing linked care, but that is not required here. And same thing here, it can be assigned to someone on their team as well. And then also for this, they have separate appointments. So this looks a little bit different. So instead of linking it to a clinic, it can link to an organization. But these appointments will also show on that appointment calendar way before if they have an appointment with getting set up with a social service. Another thing I wanted to show for HIV is the automations we have set up for viral suppression. So if we scroll down to laboratory, you see this virally suppressed checkbox. So this is determined in our system. We've denoted it if a patient in the past 6 months has 2 separate test results that are below a certain numeric value. So for this person, they currently don't have any test results, but if I go and create 2 test results quickly, we should see that checkbox automatically fill in, and this would also work with test results that are getting integrated into the system. So again, I see a lot of test types here because I have system admin, but the users would only see the ones that are needed for their workflow. So open this up for HIV. I'm going to use the quantitative viral load. I'm going to put in a numeric result, a very low numeric result of 30 and put it as not detected. And then I'm going to do this as a past test result. So we're going to say January 9th of 2026. And then I'm going to go back and go ahead and create that second one so that we can see that checkbox get automatically checked. And my screen's taking a second to load. There we go. Okay. So I'm going to go ahead and create one for this week as well. Say it came in yesterday. Also put not detective, and we're just going to put this one as 10. Then hopping back to that investigation, since we have those 2 test results, it now shows checked as virally suppressed. And this will go between different records. So this will also show on the care navigations for the other team you're talking about and on the condition history as well, so they can see it in all three places. Next, I wanted to hop in to our communicable disease, or as we call it, our DI side. And I'm going to keep using that same person that we've been looking at. And I'm actually going to start here on this related tab. And I'm going to start from the test result process. And I'm going to show it as a manual creation, but this would work the same way if it was an integrated test result. I'm going to go create a new DI test result for Campylobacteriosis, so one of our enteric conditions. I'm going to create a culture result with a test collection date of yesterday and a positive lab result. When I hit save here, we should see a condition history and investigation automatically opened up for this person without us having to manually create those records. And it's taking a second. There we go. Okay. So we see that condition history value opened up here, as well as the investigation. Most of the work on the DI side is going to be done in the investigation, so I'm going to go ahead and hop directly into that from this test result. So one thing about these investigation layouts I did want to note is they are customized for each condition. So these sections and individual fields can be hidden or shown depending on if they're applicable for the condition. And then one thing I did want to point out about our enteric conditions is we have these automatic text messages that go out once an epidemiologist is assigned to the investigation for enterics. So I'm going to go ahead and assign myself as the investigator here. And when I do that, a text message will automatically go to the phone number assigned to this person account. And then we'll also get a task over here letting us know that text was sent out. And it lets the person know that they need to contact the Dallas County Health and Human Services to follow up about this investigation so that they can better track and contact trace where this enteric condition is coming from. So gonna go ahead and assign myself. And when I do that, gonna pop over to this task panel. And we see that task was opened up that notes automatic text. And in the comments field, you can see exactly what was sent out. So it actually gives you the phone number directly instead of just the Dallas County Health and Human Services general phone number. It gives the direct line to the epidemiologist assigned to this person account or assigned to the investigator that was for it. So, and it also lets you know where this was sent and what investigation it's related back to. Other items I wanted to point out on this investigation is what we have on this log records panel. So for enteric specifically, we have another custom calendar here. And I'll show you more what that looks like when I pop over to this food history panel. First, I want to walk through this custom component we have here a little bit more in depth. So for these symptoms, complications, risk exposures, and food history, all of these values you see here are customized on a condition by condition basis. But say the person's experiencing something that's not necessarily always associated with the condition or is not a common symptom. So let's say with this case of Campy, they're also experiencing a cough. I could go in and hit cough and create this here as well. But like I said, I'm going to hop over to this food history so we can see the custom calendar a little bit better. So I'm going to note that this patient ate eggs, and I'm going to put in the date consumed as the 8th of June. Actually, I think I need to, let me go back. I'm going to put in the illness onset date, and then I think we can see what that custom calendar does. Okay, so I'm going to put this in as June 15th. Then we go back over the log records. You see these highlighted dates, and that shows the incubation period for this condition and how long that we need to be watching this person, or how long the EPIs would need to be watching this person for this condition. Other item I wanted to point out on DI is this exposed contacts tab we have. So this is where, for any condition, the EPIs can note a person that may have been exposed. So say I want to say that this person, Callum, that we're on, had a close contact with Conan. I can hit next. I can note their date of exposure. So I'm just going to put that in as June 8th. Any relationship they have with this text, the type exposure, which is casual, close, respiratory, etc. Any duration, if this was related to a mass gathering, etc. Then once I finish noting all that information, it lets me know that a contact encounter record has been created. And then down here on this list right below that, I can see all people who have been noted being related back to this person through this flow for contact tracing purposes. Next thing I wanted to point out, and you may have noticed it down here at the bottom of the screen, is our disease monitoring. So for this, these are for high priority conditions that we may be getting a high volume in at the moment, and patients that need to be monitored in case they possibly came in contact with someone or something that could have spread this illness. So I'm going to keep using that same person we've been looking at. And for this, I'm going to go through Ebola for this, because I know that has been a recent one we've been working on. So this, you can note the date of exposure. It's going to automatically fill in with the current date and their risk level, whether it's high, medium, or low. And something to note here for Ebola specifically, we have it set up so that the duration of the monitoring text that they get for this is going to vary depending on the risk level. So if it's high, they're going to be receiving those every day. Medium, they're going to be receiving those twice a week during the monitoring period. And then low, they're only going to receive it twice during the 21-day monitoring period, so that people aren't getting overwhelmed with these text messages if they aren't at a high risk for contacting it. But one thing that will change, so what happens with those monitoring text is they get sent a Salesforce survey for them to fill in any symptoms they're experiencing on the day that they got that survey. So say the EPIs went in and said this person is at medium risk, but they get a survey response back that notes they experienced a high risk symptom. That risk level's automatically on the record going to change to high, and they're going to start receiving text every day instead of only twice a week. This going to fill it in as medium, and I'm going to denote that I do want to send the monitoring notifications to these people. Then for the reason to monitoring, you can note it if it was a contact, if it was travel, environmental, or if it's from an event. So for this, going to put in travel to a high-risk area. You can note the exposure location, and you can also link it back to a particular account if it's something that happened at a very specific location instead of a general country or city. If it was something that happened at an event and it wasn't from traveling, you can note the event type, whether it was the World Cup, State Fair, Olympics, Pride, or any other relevant events. You can specify their role at the event, whether they are participant, spectator, volunteer, etc. And then if they took a form of transportation, you can note the transport ID there. And when I hit next, the system's going to notice in those monitoring notifications to this person. And it opens up what we call a disease monitoring record. So it's not going to open up an investigation yet since they don't have a confirmation or even a probable case. They just are at medium, high, or low risk level for coming down with this condition. So we're just going to see that information filled in from the flow here. And then if they need to open up an investigation for this person later on, they can do that. I think that was all I wanted to cover in Salesforce. So Dr. Wong, I can hand it over to you to go through some of the reports and dashboards if you want.
Okay, thanks, Kayla. And I'm sharing my screen now. And actually, for a few of these, I'm going to use our production because we really wanted to show you first some of the Salesforce maps. And this is all of in our production environment. So these are real cases. So like with Salesforce maps, we can get real-time visualization, for instance, for pertussis. And these are all of the cases of pertussis that we've confirmed or probable cases. I can filter that by, for instance, I'll clear it. And if I just wanted to look at, for instance, in 2026, those that were 5 to 17, say, then you can see those are the cases, the mapping for that, or I can look at where are all the cases for 2025 and get those mapped. Similarly, I'm going to show you another map. Some of our enterics, I think. Let's see. So these are the enterics. I can then, let's see. Now they're coming up. So you can see all the enteric investigations or cases that we've had. Again, similarly, I can filter that down. Let me first do just, for instance, I could say the salmonella cases in 2025. Takes a second for them to load. There's 13. Oh, that was all of 2025. Or I guess 450 cases right there. If you drill down, you can get see more where that is. So that's our Salesforce maps, and it's really very helpful to have this real-time visualization in GIS format. We have a lot of other customized reports and things you can do. Also dashboards. Let me show some dashboards. This is, again, production for pertussis cases. For all of our 2025, you can choose 2024, 24, 26, two different filters on these, but you can see those that were probable and confirmed. You can see the epi curve. You can see, again, over by MMWR week, you can see the deaths, average length of hospital stay, gender, race, ethnicity, symptom summary, risks and exposures, epi-linked cases. Actually, these are the number of investigations by some of the different investigators, and then cases by school district. On these, and I'll show you in another dashboard in UAT, that when you can drill down into this. I'll also show, this is all of our disease investigation conditions. So this is, I can filter that down. This is for 2026, but I can choose any particular cases here. Let's say, test this again for that and refresh. but I like something else. Oh, I think I hit the wrong thing. Let me do. I'll do salmonella or. I have enough cases here. Again, you can see the number of investigations, deaths, admissions, open investigations, the epi curve, breakdown by race, ethnicity, gender, age group, language, education level. I'll show, yeah, one in UAT. This is an MPOX dashboard, again, seeing the epi curve. But what's nice on any of those that I showed previously, but I wanted to get to UAT, here you can see like case by reporting facility. This is Parkland Hospital System. But if I click on any of these, then you can actually get this line list of all the people that were in that group. So again, this is fake data. That's while I was waiting for that. But for any of these, you can see, okay, I wanted to look at the 180 that were age 18 to 29. I could click on that and get right to the line list. And then you could go right into their record by pushing, hitting that record and get into their investigation data. So very easy to navigate and getting around to that. Now I wanted to go back to the slides for just the last few slides. And so just wanted to show you some of the things that were Salesforce. I've mentioned Salesforce Marketing Cloud that's integrated into our system. So this is sort of a messaging journey where you can set up, okay, for a particular defined group. Oh, is that on the wrong one? I think I've got.
Yeah, I think if you hit there.
You put it on the.
There you go.
Okay. You can set up these messaging journeys that for any subgroup, you can, say, send a text message to this person, and then if they don't open it in 2 days, then they get another text message. If they don't open that, then they get an email, and all these different branches and things that you can drop and move around to set up these messaging journeys. We're still trying to take advantage more of those. We haven't optimized that, but that's a feature we want to use. And also integrating AI into this, where actually, and I don't think we showed the social vulnerability compass on this, but we have a whole social vulnerability profile based on the person's home address that we can start using that to customize messaging, language, things like that. We're also looking at some of the features of AI agents within the Informatica AI, and so it can help with data quality rules, mapping, validation, ingestion, ELT mappings, task flows, all these things with natural language. Also Agentforce and Salesforce. These are some of the things that they're now looking at, being able to work more on sort of predictive modeling, helping out with some of the investigations, contact tracing, other things. Again, we can integrate it with some of our marketing cloud messaging. So there's a lot of opportunities with AI that we're looking at. I just wanted to show one study that we just did a pilot with AWS and Harvard, looking at to see if we could use Gen AI to pull out data from electronic case reports. In particular, we were looking at pulling out pregnancy status, travel history, and also occupational history. And so we worked with them because we get tons of ECRs every day, and with different quality And those particular variables are things that it's hard to get adequate data on. And so we used Amazon Bedrock in a segregated environment so that it was protected. And we looked at, again, pregnancy status, travel history, occupational history, and environmental exposures, use these different models. And some of the things, actually, just one of the things that was finding that, we do this to try to help our EPIs and make their jobs easier. But it is important, and these models, as we start developing this, some of the models produced even more work for our investigators to look into. So choosing those models, and as we get more into this, really optimizing what's the best use. But it's our first sort of application. One of the other things I had shown earlier, how we're making a fire and TEFCA connection, that we're also then comparing the data that we can get through fire with what we get from standard ECRs, and then now also comparing to AI. So yeah, that's what we wanted to show you with this. I do want to again mention that this is, we don't want to just show you and say, hey, isn't this great? We really want to see if people are interested in, how can we share some of this, or, exchange ideas, or we shouldn't all be having to redevelop all these things. There's a lot of different processing that we're doing with this. A lot of, the logic to create cases. And, if people are wanting to use Salesforce, we're, really looking, how are cheap ways that we could allow other health departments to take advantage of and leverage the system. So please look at that. We've been very fortunate. We've been recognized with a lot of some recognition. We got a 2023 Davies Award from HIMSS. We've got a Smart Cities Award from IDC. And we just this year are getting a Promise Practice Award from NATO 360. So we're very pleased with that. Again, if you want to contact us, this is our information. And we hope that, again, it's not just a show and tell, but how can spark some ideas and ways and conversations about how can we share this with other health departments and not have all of us have to reinvent this. So let me stop sharing that. We appreciate the opportunity to present this to you, and any questions we're happy to take. So thank you all very much.
Yeah, thanks everyone.